What's good with it, veterans, military? Today we're going to be talking about the VA proposed updates to VA disability ratings that is now in effect, effective today. Let's jump into it. So first off, we got this nice, beautiful slide. We're talking about the VA disability. This is going to be the final rule to the exception when it applies to the bilateral factor of VA disability calculations. So going into it, you see the action, the summary. Department of Veteran Affairs adopts final without changes the interim final rule that's going to govern a good amount of VA disability ratings for injuries pertaining to the feet, legs, skeletal muscles, just like I said earlier. Effective date today, December 27th. December 27th, 2023. If you got any moans, complaints about this, here's the contact information. You can contact the VA Schedule Rating Disabilities Regulations staff. There's the information, compensation service. Moving on from there. Now, the proposed update to the VA disability rating. Now, this was actually proposed earlier this year in April. VA published a rule to the Federal Registry to allow adjudicators as well as veterans to submit any comments to oppose this or anything like this. Now, just like the other two that I posted, the VA only received one comment in the 60-day period in which this was supposed to be the comment feedback period. What does that say? Let's say veterans, obviously, they don't care about it. They don't care about their benefits. They don't care about the VA rating. They don't care about the VA compensation they're receiving. And then they cry and complain once the VA actually implements a rule, just like they just did. Now, current veterans the currently effective veterans VA disability ratings will be about 64,000 veterans, 64.1 thousand veterans, mainly veterans who are receiving compensation, as well as those veterans who are the DIC payments, stuff like that. Moving on from there. So now we actually see that if you go to the CFR 38, the VA has actually updated this information, and it is effective. Well, the date of the initial proposed changes, which was April of 2023, and just reading all the correspondence, it's not really an impact to those veterans. Now it goes in to say most of the data that was taken into consideration when they were developing this rule, it was from 2022 or FY 2022, and about 2,000 veterans were rated at 90% combined rating level, who, if this change would have been implemented beginning of December 2022, they would have been pushed from that 90% to 100%. Y'all know what I'm talking about. Now, this update actually helps a lot of veterans. But the overall changes to the policy, it's going to help those veterans who are currently rated at 90% that have bilateral factors calculated into their overall VA disability. It's going to help them push them to that 100%. Now, the VA is not going to be looking at any veteran who is currently receiving TDIU, the total disability individual unemployability, because yes, their bilateral factors would apply to this rule, but the status of their VA rating at the 100% level doesn't apply to this because they're already at 100%. Now, if they were to submit for an increase, yes. If they're at 90% and they wish to work, now will be the time to do that now that this has been effective as of today. Those veterans who are at TDIU who wants to work, by all means, submit that increase. Change that designation from TDIU to permanent total 100% gain 2023-2024. Moving on from there. Those veterans at 90% rating, so it'll be about what? It's not really giving details on how many veterans is going to be affected by this, but at least in 2022, there's about 2,000 veterans, I would assume around the same amount. In previous years, if they go back that far, if it would have being the determining factor if a veteran got 100%, if the bilateral factor calculations were a little bit better than they were. They transferred or calculating the difference between monthly averages of veteran compensation payments at the 90% and 100% levels from the MSR budget and applying it to the annual caseload closeout. Now, what does that mean for veterans? I would say the only veterans this is really going to apply to are some veterans who are still at 90% that would have been rated at 100%. The VA has a process, they got a system that they plan on executing to identify those veterans and increase them to 100% permanent total. So maybe you are one of those veterans who have a bilateral factor. You're probably at like 93, 94%, and it would have pushed you to 95, 96, getting you, all you need is 95% VA disability rating in order to get that 100% permanent total gain. Now, with that being said, the VA is going to do automatic reach outs to some of these veterans who are affected. However, obviously, as always, there are always some veterans who are left behind and forgotten about. So evaluate your current disabilities, where you're currently rated at. If you have any bilateral factors factored into your overall VA disability rating, I implore you, get with a veteran service officer, veteran service organization, so that they can best manage that claim. So you're not going in saying, give me benefits, and then the VA said, okay, we'll give you something, but then we go take a little bit back. But anyways, and aside from that, that's the only significant update to this. And I wasn't expecting anything like this coming out this year. However, this is yet another thing that contributes to those proposed updates to VA disability ratings, specifically to sleep apnea as well as to mental health disorders. Now, luckily with this one helped. This one is going to help veterans out in the long run who have that bilateral factor. Now, for the other two proposals, it's not going to help any veterans out. Only at the 30 and 40% for mental health, sleep apnea veterans, they are going to fucking be fooled, especially if they're not already at 100% permanent total, or all of their disabilities aren't considered permanent. They are not considered static. And at that case, that's the time where the VA is going to be looking for those veterans to submit increases to their overall VA disability rating so they can reevaluate that sleep apnea, that sleep apnea VA rating, so they can reevaluate their mental health disorder rating. Whether it's at 70 or 50%, the VA is coming and they're going to cross-check it, reevaluate it with the new criteria. Now, just looking at this, there was only one comment submitted. More than likely it wasn't from a veteran. And we're looking at the other two proposals where it says, okay, not even a percentage of veterans commented on those. So my likelihood is definitely gonna be taking effect. I'm guessing this year, but we'll see. Hey, y'all like this type of content, you know what to do. Let me know your thoughts, your complaints, let your boy know. This motherfucking Devo, I'll stay Gucci with it.